Good morning, everybody. We will be starting in just a few minutes. Great to have you here. Please take a moment and introduce yourself. Who are you? Where are you from? And what do you want to learn? I guess that's the big question. Why is everybody here and how can I help you? For those of you just hopping on, we will get started in 2 minutes. Just getting everything set up right now. And would love to have you introduce yourself. Make sure that you are opening up the box so that you can see everybody's comments in the Q&A. Good morning, everybody. If you're just hopping on, we will get started in just a moment. Good morning and welcome. I'm going to just give everybody another minute. Everybody's seems to be hopping on, so don't want anyone to miss anything. Hey, Christy, welcome. Thanks for sharing. I hope to help show you how you can be a better trainer and meet the needs of cancer patients. That's what we're focusing on today. Welcome, Pauline. Excellent. Okay, I know it is time to start, but let me just wait one more minute. We have people hopping on like crazy. Hey, Francine, welcome. Welcome, Sharon. Bahrain, welcome. We have people from all over the world. This is so exciting. I loved seeing where everybody was from yesterday when I was on with Dan Ritchie. This is such a global coming together, meeting of the minds, all of those wonderful things. Hello, Shelley and Barb, yay. Hey, Sally, welcome. Pauline G, yeah. Hi, Hannah from Arkansas. Aliki, welcome back. All right, you guys. Well, let's do this. People will continue to jump on, and please continue to tell me where you are from in this world. I know that we're all more united than ever. It seems that COVID has brought us all together, unfortunately under kind of rotten circumstances, but we are going to overcome and be stronger and help those who need it most. So I'm Andrea Leonard. I am the president and founder of the Cancer Exercise Training Institute, and I am also a 36-year cancer survivor. Just a little overview of what brought me here, because I'm asking you to share your stories. You know, why are you here? Why cancer? I know this is cancer in the aging demographic throughout this week, but you know, we've all been affected by cancer, basically 1 in 2 or 1 in 3, depending on where you are in the world. people in their lifetime will get cancer. My mother currently is fighting the good fight with stage 4 breast cancer. This is her 3rd breast cancer diagnosis, starting back in the early 80s. She and I also both had thyroid cancer. My father had prostate and bladder and myelodysplastic disease. My uncle currently has stage 4 lung cancer, lost both my grandpas to lung cancer. On and on and on. I've had 23 first-degree relatives with some type of cancer. So I didn't choose cancer, cancer chose me. And I guess nobody chooses cancer. None of us can help but grow old. And, you know, there are things that we are about to talk about, ways that you can prevent cancer. But nonetheless, you know, certain people are predisposed genetically, and there are environmental toxins and oxidative stress that unfortunately predispose some people more than others. So let's go ahead and get started here. And let's talk about the market to serve and grow survivorship. There were an estimated 18 million cancer cases around the world in 2018. Now, typically, the numbers are released usually a year or two, you know, in the rears, if you will. So that's why I don't even have the current information for 2019. And I have a feeling that because of coronavirus and everything just kind of being shut down, that it's going to be a while before things are updated. But you can expect that the numbers continue to rise. While we are doing a better job of treating cancer and keeping people alive and living well, the numbers are not going down. Statistically, we are continuing to see an increase all over the globe. Now, 1/4 of those diagnosed with cancer are between 65 to 74 years old. So, you know, you can see the crossover between the aging demographic and those being diagnosed with cancer. Now, I was diagnosed when I was 18, and obviously there are you know, hundreds of thousands or millions of people that are diagnosed with cancer throughout their lifetime, but we definitely see, you know, this large grouping, if you will, of the aging population. So we're looking at a median age at diagnosis of 61 for breast cancer, 68 for colorectal, 70 for lung, and 66 for prostate. And these ones are listed because these throughout the globe are the most common types of cancer that we see. So in 2018, there were approximately 43.8 million cancer survivors diagnosed within the previous 5 years. And that's the number I really want to touch on because, you know, we have new people being diagnosed every year, but it continues to add to those that are already surviving cancer. And this is our opportunity. And you know, I hate to talk about capitalizing on or, you know, growing our business based on cancer, but this is just a fact. People age, people get cancer, people get disease, and we have an opportunity to give back. So yes, we can increase our bottom line, we can get new clients, but you know, more than ever, people with cancer are isolated. So I just went and spent the last 2.5 weeks with my mom on the East Coast. And that was really scary to fly there and be afraid that I would give her coronavirus. But she has spent the last 6 months completely isolated. And so not only do they have the fear of cancer, they have the fear of dying, they have some of the debilitating side effects of treatment, they're all alone. So what Dan and I want to talk to you guys about this week and teach you is, you know, how to take your business wherever you're at in the world and wherever you're at as far as your gym being closed, your studio being closed, or whether you are already doing virtual training. We are going to show you how to do it. We are going to bring you into people's homes. We are going to help get you exposure so that they can find you and they are not alone. And in anticipation of the growing number of cancer cases, going over 27.5 million new cancer cases by 2040. This is just absolutely staggering. And like I said, we may or may not be able to influence people's habits to change their behavior and prevent cancer, but we can certainly help, you know, those people who are already going through the process to live better, more vibrant and longer lives. So we know that there is so much evidence, so many studies out there talking about, eating vegan, or, mostly, um, uh, sorry, I hear my dog going up the stairs, clickety, clickety, clickety. It was a little bit distracting there. I'm like a dog, like squirrel, squirrel. So just to give you a heads up from the beginning, you can follow along with me. Eating plant-based diets, staying away from saturated fats, not living near power lines, not holding your phone to your head. These are all things that seem to cause oxidative stress. And over time, they cause changes in the DNA that can potentially lead to cancer. So, we have the genetic side of things, and then we have oxidative stress and what we call somatic changes. So what can we do? How do we convince people to stop drinking so much, to stop smoking? And when they do that together, it's 3 times as bad. We can get out there, and we touched on this a little bit yesterday, through social media, through your churches, your synagogues, your mosques, your even cancer support groups. Of course, in that case, most people have already had cancer. But keep in mind, we want to prevent second cancers as well. Get out there and start talking, start educating. So this is a win-win situation because, one, you're giving valuable information to the general public, or perhaps your family, your loved ones, but you're also becoming the local expert. You are positioning yourself as the expert. Now, I don't suggest you guys all go hop on the internet and start doing this today if you are not qualified. This is something, some of you are already cancer exercise specialists and functional aging specialists, while others of you are working with cancer patients, working with the aging population, but may not actually have the appropriate training or certification. And I really hope that you'll get on board with Dan and I over the next couple weeks for this immersion where you're going to walk out with 2 certifications. And this not only protects your client, but this protects you. So it doesn't matter. You may be the most self-educated person and know more than somebody with a PhD. If you don't have the credentials, you are setting yourself up for liability issues. And I want to do everything I can to help keep that from happening for you guys. So we know that exercise is important in cancer prevention and specifically linked to these cancers. So colon, stomach, esophageal, bladder, kidney, colorectal, and breast. Now, that is not to say that exercise will not help prevent other types of cancer. These are just the ones that there is an overwhelming amount of evidence to support the connection and the link. And every day, every month, every year, there are more studies that are being conducted to support this. And I started this in 1995. In fact, let me see if I can find this book here. Before anyone even knew what cancer exercise was. And I spent, I think it was close to 4 years working with the chiefs of breast surgery with Georgetown University, George Washington University, and Johns Hopkins University hospitals in the US to write this book, which was published in 2000. And the reason I bring this up, it's not even being printed anymore. You still can find it on Amazon, but I'm not trying to sell you the book. I just want to point out how long it has taken for this to be recognized as part of the cancer continuum. That, when I started this in 1995, first off, the internet was just starting to be, and there was no evidence. There was no research. This was an uphill battle. And, it took decades to kind of claw my way up to where this was recognized. And we are now the global leader in cancer exercise education, which is phenomenal. Not so much self-serving, but the fact that people around the world have all united for the greater good, in this particular case of working with cancer patients. So in terms of prevention, we can absolutely talk to those people who've already been diagnosed with cancer and help prevent future cancers. And as far as everyone else, without being overly aggressive about it, get out there and talk to people. And maybe do some webinars on plant-based diets or lowering your saturated fat or ways to prevent cancer. The people who are open-minded will find you. They will come to you. So it's the old adage, if you build it, they will come. And what you're trying to do is start getting exposure for yourself, because in order to be able to write for magazines or write for newspapers or be interviewed on TV, you have to kind of build your own network first. You have to develop that relationship of know, like, and trust. And we are doing this as one big united group through Cancer Exercise Training Institute and the Functional Aging Institute. We have kind of that umbrella where all of us are together underneath the umbrella, and we're working collaboratively to gain that exposure and recognition and reach out to people around the world. Now, when people are going through cancer treatment, and I want to invite you guys to share your own stories, because I'm sure many of you have gone through it yourself, or you have a family member. And while I won't be able to answer all the questions while I'm speaking, because if you think I'm squirrely when a dog's coming up the stairs, you should see when I try and go back and forth with answering questions. I will save time at the end and then continue to answer them after the webinar is through. So share your personal experiences or those of your family members. And I think it really helps for all of us to not feel that we're alone, but also to gain insight perhaps on things that you did that were beneficial for yourself or through loved ones or family members going through cancer treatment. Study after study has shown improved treatment tolerance. So what does that exactly mean? The side effects from cancer treatment can range from extreme fatigue, we know vomiting and diarrhea and nausea, but all the way to long-term side effects like osteoporosis, diabetes, damage to the heart and lungs, so on and so forth. When we talk about improved treatment tolerance, it's critical that people can withstand the side effects while they're going through treatment. Otherwise, what happens? They quit. And then, of course, whatever treatment it was cannot be effective. But sometimes the side effects are so unbearable that they have to look for other treatment options. But we have seen reduced nausea, increased appetite. Now, that is critical when people have muscle wasting or cancer cachexia, that they have an appetite, that they are able to eat and get the appropriate nutrients to keep them strong and keep them from withering away. And fatigue affects 76% of cancer patients going through treatment. And this is not like the fatigue that we have, when you don't get enough sleep, or you've been up studying all night for college exams, or even if you, had too many drinks and you're, really tired and hungover the next day. Nothing like that. This is completely debilitating fatigue, to the point where people, they're laying on their couch and they don't care if their teeth rot out of their head. They cannot get off the couch to go to the bathroom to brush their teeth at night. So this really begins to affect somebody's quality of life, because it's not just about personal hygiene and doing the things that someone has to do. It's also about doing the things that bring them joy. And when you have no joy and those things are all stripped from you, oftentimes people lose motivation. And so I'm seeing this kind of twofold with my mom right now. One, because she's 82 almost, and just feeling isolated and alone, all of the physical ailments that just come along with getting older. And I'm gonna paraphrase that and say, and not taking care of yourself, because as Dan spoke of yesterday, there are plenty of people who are aging fabulously and can live, well into their 90s and still function well and do the things they love. But also, it's that isolation and being alone and not having people to talk to, not having touch, not having somebody, in your space. This can really add to the fatigue and just the lack of desire to go on. And that, when people lose that inspiration or motivation, then they kind of start to just fizzle away. And that's the thing about the aging population. You have those that age vibrantly and well, and the others who maybe don't have that same positive outlook on life. don't feel loved, don't have family, have physical limitations, that just kind of check out. And so it's really important that we can get, kind of get in there and help those people, being a cancer concierge, not just a cancer exercise specialist, but maybe you're that person who helps them, order food online, or checks in once a day for 5 minutes and, does some deep breathing and motivation and just putting a smile on their face. That goes so far these days, you guys. So talking about increasing appetite, but also that helps to maintain the lean muscle mass that is often lost through cancer treatment. So again, that word cancer, cachexia. A lot of people experience pain. Now, the pain could be from the tumor pressing on a nerve or a group of nerves. It could be direct invasion of the cancer to the nervous tissue. It could be from burns, from radiation or hyperthermia. Any number of things can lead to pain, but the endorphins that are produced through exercise will help to minimize that pain. And remember, as all of these things are managed or minimized, that allows somebody to withstand higher doses of treatment, which can also shorten the amount of time that they're undergoing treatment. People have a difficult time sleeping. Oftentimes it's related to the medications they're on, especially corticosteroids. And if somebody is not getting enough sleep, they cannot heal. So sleep is critical, and helping them with meditation and deep breathing. These are all components that you can add to your programming. So it goes beyond just exercise. We know that exercise is going to help increase energy and give them more stamina. This will help them get through their day-to-day tasks, as well as do the things they enjoy doing. So, you can have people who are avid exercise enthusiasts, that are golfers and hikers and cyclists and joggers and what have you, well into their 70s and 80s. And this is a huge component, a huge part of who they are. So as soon as we can kind of, if you will, get them back up on that bicycle, they're going to start to feel better about life and have an increased satisfaction with life. And these are the people who are going to do so much better through treatment, and also combating the depression that is often associated with a cancer diagnosis and the ongoing cancer treatment. Now, any of you who have worked with cancer patients or who yourself are cancer survivors or perhaps patients can probably have a better understanding of what I'm about to talk to as far as the physical side effects. Oftentimes, after cancer surgery, there is a decrease in shoulder range of motion. Now, obviously, this depends on the type of surgery. So when you're looking at head and neck cancers, breast cancer, of course, we see this a lot with limitations in shoulder range of motion. And we as fitness professionals have to have a way to measure this range of motion. We use what's called a goniometer. I was going to grab one here. Here it is. This is the baby goniometer. And this is awesome because you can do this virtually. You can actually do goniometric measurements through your computer screen and use this little 6-inch goniometer to take the measurements. And this is all part of our coursework. Not only do we teach you how to use the goniometer, but we're also teaching you how to take your business virtually. So why is this important? Because if you do not help your client to regain full range of motion or close to full range of motion in the affected joint or limb, and we start putting a load on it, whether it be through holding a yoga pose or using a Pilates reformer or doing strength training, whatever it is, then you are going to potentially limit their range of motion because they will be stronger in this limited plane of motion. So there really is a method to the madness in terms of recovery and programming. So identify range of motion limitations and then identify muscle imbalances through a comprehensive postural assessment. So, we determine out of that half hour or hour that we have with this client, what are the most important things for them to do today. And that may change tomorrow. That will most certainly change over the next couple weeks and months. So we have these progressions, and sometimes we have regressions, and you need to understand, you know, when to take a step forward and when to take a step backward. Does anybody have any idea what lymphedema is? I'll give you guys a second if you want to write it in the Q&A. Yeah, Courtney, your hand is up. I don't know if you want to write it in the chat box or if that's even what you're talking about. But does anybody know what lymphedema is? Okay, water retention. We're along the right path. Swelling in the extremities, swelling of a body part. So yes, you guys are all partially right or completely right. What lymphedema is related to damage to the lymphatic system. So edema is water retention, but lymphedema is damage to the lymphatic system from radiation, lymph node removal, chemotherapy, surgery that can cause a backup of lymphatic fluid. So it can cause it to pool, if you will, in the affected limb. It can also be in the torso. And this can be very painful and debilitating. And it is also progressive if it is not treated appropriately. So what does that mean to you all? You need to understand lymphedema. You need to understand the lymphatic pathways, and you need to incorporate lymphatic drainage exercises into the workout for anybody who has had lymph nodes removed or irradiated. And then there are other factors like chemotherapy that probably on its own will not cause lymphedema, but can increase the risk exponentially, as can a higher percentage of body fat, poor nutrition, and just overall poor health. So understanding how and when to incorporate these exercises, and also knowing that lymphedema is a lifelong affliction. While it kind of peaks at around the 2-year point because of scar tissue and adhesions, they are at risk for their entire life. Now, somebody just put something about being afraid of doing massage. If you are not a certified lymphatic therapist or lymphatic drainage therapist or physio, you should not have a hands-on approach as a fitness professional, especially when it comes to working with cancer patients. Other than some perhaps active isolated stretches, you do not want to be doing anything with lymphatic drainage and anything that could apply pressure to an affected limb that could interfere with the flow of lymphatic drainage. And that could even be foam rolling. So remember that I am giving you just some morsels of information today, but that this in no way will make anyone an expert. You know, Barb, if you want to jump on, or Pauline, and you know, you can share with people what you had to do to become a cancer exercise specialist, the complexity of it, and how much information is involved. I mean, we have 500 pages just in the manuals. Don't want to scare you guys though. It's doable. It's doable. I swear. So exercise is going to help people increase their lean muscle. It's also going to help lose fat, which will reduce their risk of diabetes, heart disease, future cancers, and yes, lymphedema as well. We're going to help people get back to work and activities of daily living, and help with increased self-esteem and self-confidence, which is, you know, imagine these people who they've lost their hair, they've lost their eyebrows, they've lost a breast, a testicle, a limb, maybe they've lost their job, their spouse. Cancer strips you of everything. When you are diagnosed with cancer, the moment you hear that word or that sentence, your life is forever changed. And I remember coming out of surgery and saying to my grandfather, sorry, I get all emotional, "Pop, do I have cancer?" And he just started crying, you know. So imagine laying on the gurney, you're 18 years old and you're told you have cancer. So here I am, you know, 38 years later, or however old I am, maybe it's 36 years ago. And I'm a better version of myself. And I've been able to help people all around the world through my own personal experiences, but I'm not the same person. I'm not the same person I was, you know, in June 1984. I feel that it's changed me for the better. And so many people will say that, but oftentimes they need a catalyst or somebody to hold their hand and help them on that journey. And that's where we can come in and make a huge, huge difference. We're going to help people prevent these comorbidities, which I've mentioned already a couple times, but I want to emphasize to you how important it is that not only are we dealing with the side effects while people are going through treatment, but being able to understand that your client, if they went through chemotherapy, they are at risk for all of these comorbidities, and each and every one of them can be prevented or minimized through exercise. So that's a pretty amazing thing to be able to have that. Power is probably too strong of a word, but I like the word catalyst, because we're like that launch pad for people to have a better, healthier life. And exercise really is medicine. It's cliche, it's overused, but it's true, because chemotherapy does not cure cancer. Insulin does not cure diabetes. These are simply Band-Aids. They prolong life and perhaps improve quality of life, but they don't cure the disease. Where exercise can actually have more of a profound effect on curing or preventing disease than any pill or form of medication ever will. So how then can physical activity be linked to reduced rates of cancer? Well, first of all, breast cancer, prostate cancer, testicular, ovarian, many of the reproductive type cancers are affected by estrogen, progesterone, testosterone, where these hormones cause the cancer to grow. It's like fuel on a fire. Or, people who have insulin resistance, and maybe it's because of obesity or they're pre-diabetic. So exercise can help to manage these hormones, which can, of course, have a favorable effect. And we know that with obesity, it's linked to all kinds of diseases and comorbidities, but exercise will help with insulin resistance. Exercise helps reduce inflammation. Inflammation is directly related to immunocompromisation. What is immunocompromisation? If you haven't heard this term lately, I'm thinking that you're not listening to the news or watching TV or whatever. Although I like to refrain from that as often as possible. But immunocompromisation means your immune system is compromised. It is not working efficiently. And so with COVID, I think this has been a real eye-opener that, people need to take better care of themselves. And all of these things that we do, the foods we eat, the things that we ingest, whether it be, topically or that we swallow them, it causes our body to have inflammation. Inflammation can lead to infection and then ultimately to a compromised immune system. So exercise is a huge part of this continuum, but diet is the other part. Now, let me tell you, if you are a fitness professional, or for that matter, a health professional, if you are not trained specifically, i.e. a registered dietitian, specializing in oncology, you should not be making dietetic or dietary recommendations. It is out of our scope of practice, and you can do more harm than good. So, we have referral lists, and amongst our global group of cancer exercise specialists, within that group, we have registered dietitians, we have naturopathic doctors, we have physios and OTs, and we can all refer to one another. So we create an even stronger network of professionals that are going to serve the cancer population with the best protocol, the best treatment, the best programming possible anywhere in the world. And that's the beauty. Now that everything is virtual, it doesn't matter if you're in Bahrain or if you're in the United States or Australia, we can all work together. Continuing on here, really important that people move their bowels on a regular basis, and exercise can help speed up the passage of ingested foods, which, if they stay in contact with the mucosal lining of the stomach for prolonged periods, can actually become carcinogenic. So you probably never thought I'd be talking about going to the bathroom, but I did. So ultimately, lifestyle equals outcome. People who lead a healthy lifestyle, by and large, have a better quality of life, a better outcome, longevity. And there is a need, which means that there is an opportunity. So wherever you are in the world, you are not spared of COVID, and you are not spared of cancer. And you certainly are not spared of the aging process. So 50% of doctors really don't know how to prescribe specific exercises for recovery. And the 50% that do are probably orthos, or they're physical DPTs, doctors of physical therapy, where, otherwise they're getting maybe a couple hours in their medical training. And besides the fact that they are curing the disease, they're doing the surgery, they're prescribing, this is out of their scope. So this gives us an opportunity to come in and be that next step in the healthcare continuum. And while a physio or an OT or even a doctor or nurse can certainly become a cancer exercise specialist, there is a point in time where the patient is going to stop being a patient, and they are going to go, into mainstream fitness, or, whatever that looks like now with gyms being closed down. But there's a point where insurance isn't paying for it anymore, and that physio or that doctor or nurse is going to want to hand the baton to somebody who can prescribe exercise. And whether you are in aquatics or Zumba or personal training, yoga, Pilates, whatever you do, you can create a customized exercise program specific to the needs of cancer patients. And that's what we teach you how to do. So even if it's in a group setting, how do you do that? How do you get a bunch of people with different types of cancer, different surgeries and treatment protocols? How do you put them all in one class? It's very difficult, but there is a way to do it, and there is a way to do it safely and effectively. And that is all part of our training. Surgery, as well as radiation, can affect flexibility. So we know for a fact that a structured exercise program, choosing the appropriate exercises, can help increase range of motion, help that client perform activities of daily living, improve lymphatic flow, we talked about lymphedema, decrease pain. Now, one of the things that happens quite frequently, and my mom's been talking to me about this for decades, is when there is muscle spasms. So for example, after mastectomy or radiation to the chest wall, the muscles become spastic, and there is a lack of blood flow or ischemia to that area. And that in and of itself is causing pain. So by the simple act of stretching the muscles that are in spasm and strengthening the opposing muscle groups, we can minimize or eliminate a lot of the pain that people are dealing with post-surgery, post-treatment. It is amazing. I've worked with hundreds of cancer patients throughout my career, and I have seen unbelievable transformations from people who were so feeble and in so much pain to athletes, to people who are thriving. And that's another word I hate to use because it's overused, but it is true. We're going to help people with their posture, which is going to minimize pain associated with kinetic chain, muscle imbalances. It's also going to help prevent injury and improve performance. But what we need to teach you is, when is it appropriate? When is it too much? And then talk about the limiting factors, such as pain, fear. There are more. There could be contraindications based on their surgery or treatment. But you need to understand this inside and out before you can safely prescribe exercise for cancer patients. Now, if any of you are yoga instructors out there, it seems pretty safe. Oh, it's yoga, that's easy. But if you are having somebody hold a yoga pose for a long period of time, you are actually doing isometric strengthening, which, if they do not have their range of motion, you can be doing more harm than good. You can be setting them back. If you are having them stand on a limb that is at high risk for lymphedema, or even do something like a plank if they've had a mastectomy or they're at risk for upper body lymphedema, that could actually increase their risk or even set off lymphedema. So you absolutely have to understand how to modify the poses. Anybody can do meditation, anybody can do relaxation and deep breathing, and they should, but you need to understand how to accommodate each individual. So it will help with their relaxation. That will also help minimize some of that spasticity in their muscles. It's going to help them manage their stress and decrease depression, reduce anxiety. And we know there's something called a type C personality, which has a lot to do with stress and repressed emotions. And these people have a higher likelihood of getting cancer. So Google that, type C personality. It is part of our coursework, but if you want to just check it out now, you'd be surprised. You know, I'm sure you know somebody who fits that description. We're going to help minimize pain, improve performance, and burn calories. And again, understanding when it's appropriate, when is it too much, and what modifications you need to take. Swimming is awesome. People love the water. It's going to help increase range of motion following surgery and radiation. It's awesome for arthritis. And the hydrostatic pressure of the water against the limb can actually help prevent or manage lymphedema. It's going to help people stay cool during a workout, which can also, by reducing the body temperature, that can reduce the risk for lymphedema as well. Strengthening their heart. The heart and lungs can both be damaged from treatment. It's going to help increase strength, which many people with the muscle wasting and just overall atrophy have lost a good amount of measurable strength, and then ultimately burn calories. But you also need to know when it's appropriate, and that if your client is immunocompromised, they should not be swimming, whether it's in a pool, a lake, a river, the ocean. It is going to increase their risk of getting any type of bacterial infection. If they have skin irritation, perhaps from radiation, maybe there's burns, hyperthermia, there's blisters, they should not be in the water. And if they have an external port, that is what we call an absolute contraindication, which means under no circumstances should they be in the water. So you need to understand each of these components. And even with cardio, it seems as though everybody can do cardio. We know it's going to decrease fatigue. It's going to increase energy for sure. The endorphins that are produced are going to give people that much needed energy, strengthen the heart and lungs, burn calories, and also improve quality of life. But when is it appropriate? Do you know at what intensity somebody, should be working out at? Did you know that we have to use the Carvonin method to incorporate their resting heart rate, which is elevated in those that are going through treatment? And what is too much? I mean, is there such a thing as too much? Absolutely. You could do too much too fast. That could cause lymphedema. You could put somebody on a treadmill who has peripheral neuropathy in their feet. That could be from diabetes, or that could be from chemotherapy. And they run the risk of falling and really getting injured. So you have to strategically choose what cardiovascular exercises somebody should do, and know that if they're at risk for lymphedema in their lower extremities, that anything with repetitive motion for their legs is going to increase their risk of lymphedema. Or if they're at risk for upper extremity lymphedema, anything they're doing with repetitive motion on their arms can increase their risk for upper extremity lymphedema. And also understanding neuropathy, and that if they are at risk for falling, we need to work on balance, but we need to do so in a very safe manner, and certainly not put somebody on a moving object or something that they can fall off of. Strength training is going to be critical for increasing bone density, reducing the risk of osteoporosis, which not only, is it a concern for anybody who's aging, but once somebody's gone through chemotherapy, that's going to increase the risk even more. And different medications can also add to that. So when we are looking at somebody's profile, we have to look at all of these different elements to decide where to put the emphasis. We're going to help improve body composition, burn more calories, improve quality of life, and help with self-confidence and strength, and also perform activities of daily living. But did you know that if somebody is at risk for lymphedema, you don't want to have them wrap a band around that limb, as that can restrict the flow of lymphatic fluid and increase their risk of lymphedema? That if they have neuropathy in their feet, they may have a difficult time not only with balance, but that they should not perform any high impact activities. And if it's in their hands, anything that requires fine motor skills can be affected. So you want to be really careful that they're not going to let go of a band and it snaps and hurts you, or it hurts them, or that they don't drop a weight and hurt you or them. Balance and core is critical. It's obviously affected as people are aging, and then it's just compounded with cancer surgery and treatment. So we need to help people to prevent the risk of falling, therefore preventing injuries, and also reducing back pain, increasing strength, and improving activities of daily living, or the ability to perform activities of daily living. But even with balance and core, if someone has multiple myeloma or if they have bone metastasis, it is going to be critical that there is virtually no risk of them falling. We have to take every precaution possible. And so we'll go through this in a lot more detail throughout the course. But why do you think mainstream exercise programming fails when it comes to cancer patients? Can anybody answer that for me? Why do you think? Anybody have an idea? Why does mainstream exercise programming fail? Well, for one, since nobody's jumping out there and answering it and we're running out of time, people don't know. They don't know all of the implications for working with cancer patients. The doctors don't know what exercises they should do, and the fitness professionals are not trained. Yes, Michelle, too aggressive. Barb, too generic, not specific for their needs. Not enough knowledge. Maurice and a number of these folks have gone through the course. So thanks for jumping in. So you guys have to understand safety and efficacy. What is the purpose of the exercise you're choosing? What is the risk versus the reward? You need to be specific to what the goals are that you're trying to accomplish. So how relevant are these exercises? I mean, does doing a bicep curl have any bearing on their cancer recovery? And if it's appropriate. Okay, so we have an awesome special promotion for you guys. And I'm just gonna real quickly go through this and then I wanna answer questions. So for those of you who are already cancer exercise specialists or functional aging specialists, you can hit me up at CETI, Cancer Exercise Training Institute, CETI Guru @gmail.com, and we'll give you a special price for the other one that is not, that you're not already certified in. But this is amazing. So you get the cancer exercise specialist course, functional aging specialist course. You get live training with Dan and I from August 31st to September 21st. You get exam preps, all of the exams, additional training, webinar, videos, all that. Plus, you're going to get the Tai Chi certification program. So the course cost is $1,149. This is US. But if you use this code, MyKickstart, it's only good through August 30th. You can save an additional $350 and you can get started for just $25. So we are not just going to hand you a piece of paper, guys. This is not about just giving you a certificate. This is not about taking your money. You are going to get added to the Cancer Exercise Specialist Directory. You're going to get added to the American College of Sports Medicine's Moving Through Cancer Directory. You're going to get added to the Functional Aging Institute Directory. We are going to teach you how to grow your business, how to take your business online and create that niche market. And Dan talked about some numbers yesterday. He gave examples of some of the Fit Body boot camps that are doing aging. I forget what they call it, but they have a different name other than Fit Body Boot Camp. And they're taking their downtime when all the people who are, working, who are still employed, are not in the gym, not in the facility. We are going to teach you how to fill that time with viable clients. Give a service that is going to make you feel good at the end of the day, at the end of your career, for the difference you've made in people's lives, and also help you to have a phenomenal and regular income. So, Pauline, you added to not taking into consideration side effects back on our last slide, which is absolutely another issue why programs fail in mainstream fitness. So, all right, you guys, I am here for you for the next couple minutes. Does anybody have any questions, anything that I can answer for you? You can put it in the Q&A or the chat box. Okay, so FAI, does it have renewal requirements like CES? That is a really good question. And Barb, I'm going to have to ask Dan and get back to you on that. Now, with the cancer exercise specialist, the information is changing on a regular basis. I mean, every month, every year, there are new studies, there are new treatments, there are new surgeries. So we update our materials every 2 years. And in order to stay certified, you must retest and go through the new materials every 2 years. Now, yes, that may be a pain, but what this does is this puts you at the, the upper echelon, and anybody who knows about CETI knows that we have the highest standards, and that is going to make you more employable. That is going to help you get clients, and that is going to help you to create the image and being the expert in the field. We want to help you become that local expert. So Barb, remind me to ask Dan about the FAI requirements. I'm pretty confident that you don't have to take a test, but I'm sure there's probably some recertification. So let's see, let me try and navigate this. Okay, what if the Tai Chi cert does not interest you? Can you take that $199 off? No, Eve, we can't take that off, but we can probably give you a different course instead. So maybe the breast cancer recovery BOSU specialist, Pilates mat. Hopefully that will be of interest to you. Everything's already set up, so I can't really adjust the price. Okay, any deals for those of us who already have FAI specialist and Tai Chi certification? Jim, I am absolutely certain we can work something out. Please email me here. I'm going to put it in here. CETI, whoops, if I could spell CETI, guru@gmail.com. And I will work something out for you. Lisa, recertification currently is $149 US. My goal is to actually lower that, but I do feel that you're getting a ton for the money, and you'll also get lots of CEUs. Dan talked about CEUs. I mean, we have ACE, AFA, NFPT, NASM, NSCA, CanFit Pro. We're applying for, it's in the works with Australia. Pretty much we've got most of them covered, and even if we don't, you can petition it, and you'll definitely get, for our course, for the cancer exercise specialist, it'll be anywhere between 20 and 30 hours. So Dan took a stab at it yesterday and said 15 to 20 hours, but it's actually 20 to 30. Pam, how long is the program? What is the test procedure? So you have 6 months from the day you register, even though we'll go through all these live webinars, in that first month. The test for cancer exercise specialist is open book, untimed. There are 125 multiple choice questions. Now, the reason it is this way is because I'm trying to simulate a real life situation in which you would meet with the client, you would gather all of the information, and then you can go back to your office or back to your home. And if you have to spend 2 hours going through your materials to figure out what exercises they should do, then you do that, because it is virtually impossible for you to memorize all of this material, and there is no room for errors. So I'm sure that Barb or Maurice or Pauline would all tell you this is one of the hardest tests they've ever taken, despite the fact that it is open book. But it has to be, because how can we say that someone is a cancer exercise specialist, or for that matter, a functional aging specialist, if they took a 30 question or 50 question easy test? I don't want to put my name on, behind that person. So I want to protect you guys, and I also want to protect the clients. So hopefully that answers that question for you, Pam. Let's see if there's any other questions looming here. Okay, if we have a CES from NASM, is the price lower? So Courtney, yes. So, well, corrective. I think you're talking corrective exercise specialist, not cancer exercise specialist. So that would not affect the price at all. However, we do give 1.9 NASM CEUs for the CES course. Let's see, sorry, could you repeat the email? Yeah, here's the email again, and maybe CETI guru, sorry, my typing leaves a lot to be desired, guru@gmail.com. So if you already have the cancer exercise specialist, or you already have functional aging specialist, and you're interested in the other, and you want to get in on this experience with Dan and I, this immersion, then please email me at cetiguru@gmail.com. And let's see what else. So Jim Poindexter, hopefully that answers your question also. We'll work out a deal for you. Okay, so total price, Allison, I'm going to try and go back here. Whoops. I'm terrible at this. So here we go. I have fat finger syndrome or something. So the total price is $11.49, but remember, you are getting an extra $350 off for the 3 certifications and the live training. This is the first time Dan Ritchie and I have collaborated to come together like this. I am so excited, to share both of our knowledge with you guys and help you to take this next step. Tai Chi is Diane Bailey's course. So Barb, if you already have that, again, if there's something else that we can offer you instead, I'm pretty sure you have every single thing we offer. So other than me coming over to shine your shoes and help you get ready in the morning, I'm not sure what else I can do. Let's see here. Okay, what time? All right, a couple more minutes here. All right, I'm coming over. All right, so Roger's asking me to go back to the last slide. So I tend to keep going forward and not backward. There we go. So hopefully that is what you guys are looking for there. So just to reiterate, when you are done with this, you are going to have the title and the skills to build, grow, and run your own business from anywhere in the world, virtually or in person. It's return on investment, guys. Whether you have the CEUs or not the CEUs, you have to ask yourself, all these certifications and trainings that you've done, and we've all done them. I've been a personal trainer since 1992. And we all get sick of paying recertification fees, and we all get sick of having to pay constantly. That's why we want to give you return on investment. I want you personally, speaking for myself, to get so many clients that this pays for itself time and time again. It is not my goal to take your money and in 2 years have you go, I'm not going to recertify because I never got any clients. Does the Christina Phipps breast cancer cert carry any accreditation or discount? To be honest with you, Karen, I've never heard of it. Which doesn't mean anything. I mean, there are other courses out there. If you want to write me at cetiguru@gmail.com, I can explore that more with you because I can't even give you an educated response. Thank you so much, Rosie. I appreciate that. And Pauline. And I didn't pay these guys to say this. Swear, did not. Pauline has been working at Sunflower Wellness and now Maple Tree Cancer Alliance up in the Bay Area for years. And that is another partnership we're working on, so that for those of you who actually would like to work in a clinical setting, we will provide additional training and there may be some job placement opportunities. So many amazing things going on, guys. We have a huge medical advisory board and people around the world that are basically wanting to build this business with us so that more cancer patients and survivors have these resources anywhere they are. Okay, can I go one more slide forward? All right, I'm gonna try this again, Eve. I don't know how good I'm gonna be. Okay, there we go. Are the live training sessions specific to cancer exercises? Their info focusing on older adult clients without cancer? Absolutely, Allison. So these are going to be, and I think you should be able to see the curriculum when you go to the website. You'll see the ones that Dan is leading. You'll see the ones that I am leading. And then you have immediate access to all of the course content. So on our learning management platform, we have additional videos and webinars and practice quizzes that you'll have immediate access to prior to beginning the live webinars and, all the way, for the next couple of years, however long you maintain your certification. Divine, hopefully I'm pronouncing it right. So glad that you are here today and that all of you guys were able to get in. We overcame some of the Zoom issues. I know many of you could not get in yesterday. Make sure to go to the CES/FAS Kickstart on the CES Facebook group. Every day there will be little homework assignments. I uploaded the workbook, which apparently you guys can't download. So I'm going to go in there now and try and fix that. Every day, the current recording will be uploaded into the units section. So please look for the units. That's where you will find everything each day. Okay, so hey, thank you guys for all being here. This is amazing. People from all over the world joining us this week. We all want to change lives and really make a difference. And I am so proud to have the opportunity to work with you and to help you. So Pauline, you're saying you could download the workbook? Pauline G. Okay, so good. I don't have to go into the Facebook group. I guess it's user error. But if anybody needs me to email them the workbook, I'm happy to do that as well. Just hit me up at cetiguru@gmail.com. Thank you, Barb. I'm sure you will see as soon as I know anything. Appreciate the support. Pam, if you're looking to access yesterday's webinar, please go to CES/ here, let me show you what it looks like. Sometimes a picture's worth 1,000 words here. Okay, so this is the Facebook group you want to go to if you are not in there already. And then if you look right over here, you'll see units. So if I click on units and you see day 1, you can see what's listed in there, okay? And the workbook should be on the home page. So I hope I answered everything. Just take one last quick look to see if there's any questions. I don't think so. All right, well, I am gonna sign off, guys. Look forward to you guys being on the rest of the week, and Dan and I will kind of be going back and forth. Thank you, Courtney, appreciate it. Barb, thanks for being here. Wendy, Christine, too many of you to name, but I do see you all here, and really thank you for being here. Have a great day.